There's a lot of misinformation out there about sex during pregnancy. Some people believe that it's completely safe, while others think it's dangerous. So, what's the truth? Has pregnancy spiked your interest in sex? Or is sex the last thing on your mind? If you or your partner is pregnant and you're wondering about what continued sexual relations might mean, here's what you need to know about sex during pregnancy. Topics we will talk about in this video are: is it beneficial or safe to have sex during pregnancy? What happens to sperm in a pregnant woman? Where does it go? Is sperm safe? What happens when you continue to have sex while one partner is pregnant? Can you conceive another baby while pregnant? Can you use a vibrator while pregnant? Will it hurt the baby? Is it beneficial or safe to have sex during pregnancy? It's generally safe to have sex while you're pregnant. Many people are afraid to have sex in the first 12 weeks of pregnancy, but in most cases, it's completely safe. Most couples can engage in sexual intercourse throughout pregnancy up until delivery. Sex during pregnancy is a very important factor. The importance of sex during your pregnancy cannot be overstated. It plays a vital role in the health and well-being of both the mother and her unborn baby, as it helps to produce endorphins which improve mood and relieve stress. Sex during pregnancy is a great way to stay connected and intimate with your partner. It also has many benefits for you and the baby, from relieving stress, reducing nausea, boosting immunity, to preventing premature deliveries. Mood boosts and increased cardiovascular blood flow are common benefits to pregnant women who have sex, and these can be passed along to baby as well. Sperm and vaginal sex can help induce labor when the time comes. Oxytocin, one of the key hormones involved in progressing labor, is released during sex, and orgasms mimic contractions. Where does sperm go in a pregnant woman? Many people worry that the sperm that's ejaculated during sex will somehow affect their growing baby, or that they'll injure their baby by having sex. Semen and sperm deposited in the vagina during penetrative vaginal sex will not harm the baby. Most of it will simply be discharged from the body through the vaginal opening. Placenta, amniotic sac, and mucus plug covering the cervix are the protection system that's very specific about what goes in and stays out. Your growing baby is protected from coming into contact with your partner's penis. No matter how deep it may go, sexual activity won't affect your baby, as long as you don't have complications such as preterm labor or placenta problems. However, pregnancy can cause changes in your level of comfort and sexual desire. Recommended sexual positions. As long as you're comfortable, most sexual positions are safe during pregnancy. Oral sex is also safe during pregnancy. As your pregnancy progresses, experiment to find what works best. Let your creativity take over, as long as you keep mutual pleasure and comfort in mind. Are condoms necessary? Having a sexually transmitted infection during pregnancy can cause serious health problems for you and your baby. Avoid all forms of sex, vaginal, oral and anal, if your partner has an active or recently diagnosed sexually transmitted infection. Can sex during pregnancy cause a miscarriage? Having sex during pregnancy won't provoke a miscarriage. Most miscarriages occur because the fetus isn't developing normally. Can a pregnant woman conceive another baby? Superfetation is an exceedingly rare possibility. It's highly unlikely for a pregnant woman to conceive again. When a woman becomes pregnant, hormonal changes temporarily stop her ovaries from releasing more eggs. The lining of the uterus also becomes much thicker, making it more difficult for another fertilized egg to attach, if one happened to wander down that far. Finally, a plug made of mucus forms in the cervix to prevent sperm from swimming up into the uterus. Your chances of conceiving another baby are nearly non-existent if you're pregnant. Superfetation is well documented in a variety of other mammals but highly unlikely in humans for a number of reasons. In fact, fewer than 10 cases have been reported. Is sperm safe for a pregnant woman? Sperm is typically considered safe for pregnant women and babies. Nevertheless, check with your doctor if you have any questions about the overall safety of sex due to any risk factors associated with your pregnancy. Not only is sperm safe, there are some benefits to having sex and contact with sperm before and during pregnancy. prostaglandins in sperm can help ripen the cervix. Having sex while pregnant won't cause early labor in low-risk pregnancies. If you decide to have sex during pregnancy, one thing to keep in mind is that sexually transmitted infections can still be passed while pregnant, so appropriate protection should be taken. At a minimum, pregnancy can affect your libido and which positions are comfortable. So it's important to have open conversations with your partner around your evolving pregnant sex life. What if I don't want to have sex? That's okay. There's more to intimacy than sex. Share your needs and concerns with your partner in an open and loving way. If sex is difficult, unappealing or off-limits, try cuddling, kissing or massage.